Good afternoon. Thank you for this opportunity to discuss the many and varied needs of middle school girls in Metrowest. My name is Rebecca Parkhill, and I am one of the co-founders and co-directors of the Metrowest Women's Fund. With me today is Rachel Sagan, my co-founder and co-director. To begin, I'd like to talk about who we are and what we do. The Metrowest Women's Fund is 2.5 years young, with a mission to identify the needs of women and girls in Metrowest and to raise resources to meet those needs. A women's fund uses a gender lens in philanthropy and grant making to effectively address the issues and barriers that women and girls face. Women's funds accomplish great things, improving the lives of women and girls and their communities.
We do this work in several ways, including grant making to organizations that serve women and girls in Metrowest. We also conduct and initiate new research. We convene women and girls serving organizations, elected officials, and other stakeholders to address the trends and issues facing women and girls in our community. Our grant making and programs concern 3 impact areas with a focus on the needs of women and girls from low incomes. Our 3 areas include educational opportunity, safety from violence, and girls, the next generation.
I want to tell you next about why we initiated the needs assessment of middle school girls in Metrowest. Middle school is a critical juncture for girls, especially those from low and moderate incomes who have limited access to resources ranging from menstrual health products to mental health services. Think back for a moment to your own experience in middle school. Consider what images and phrases come to mind. I wonder how many are positive. To quote from the Worcester Needs Assessment of Middle School Girls, girls' needs, experiences, challenges, perspectives, and resources are often unique and therefore need to be examined separately from those of boys. Middle school is a time when many different types of transitions occur simultaneously: physical growth, cognitive development, social changes, and school restructuring. Easily accessible, currently updated data on girls are lacking.
Also, more information from the American Association of University Women from 1994, still true. Many girls emerge from adolescence with the poor self-image, constrained views of their future and their place in society, and lack of assurance about themselves and their abilities. Popular culture, and I might add social media, further helps to deflate girls' self-esteem by marginalizing women and stereotyping their roles. The mission of the Metrowest Women's Fund is to change the lives of women and girls living in low incomes by identifying their needs as well as their gaps in services, and by raising awareness of those needs and to raise funds to meet them. We believe this needs assessment of middle school girls in Metrowest will provide crucial data for those working with and serving the girls in our community. It will allow them to identify gaps in current services. The needs assessment in Metrowest explicitly concerns 11,600 middle school girls and their families from 33 towns.
I'd like to talk now about the project itself. In partnership with Framingham State University, the Metrowest Women's Fund conducted a needs assessment of middle school girls in Metrowest. There has never been such an assessment done here in Metrowest. The report identifies the needs of girls and produces critical data on issue areas including emotional and mental health, self-image, gender identity, social relationships, physical activity, and COVID concerns. We have 3 project goals. Number 1, use data-driven research to identify both emerging and ongoing needs of middle school girls, particularly those from low incomes. Number 2, educate community residents, stakeholders, and leaders about the identified needs. Number 3, educate our donors about the needs, existing resources, gaps in services, and make the case for increased strategic philanthropy.
Now we're going to talk about how we did it and our response. We did it with an electronic survey and questionnaire regarding the needs of middle school girls. It was prepared in 2020 in the depths of the COVID pandemic. In January and early February of 2021, the questionnaire was sent to principals from 37 middle schools in the Metrowest catchment area. The response rate was amazing. 54% of the principals took the time to complete the survey. Principals at 20 of the 37 schools responded. The response was very strong. The towns represent large and small communities, towns with great ethnic diversity, and a full range regarding the incomes of community members. The entire report and our results, as well as the executive summary, can be found on our website. It produces critical data on so many issues facing our young girls. The report presents the results of the survey. There were several areas that rose to the top that were areas of concern. We're going to go through 5 of them today with you. The first one was about mental health conditions, including depression and anxiety. That was found it was of considerable concern. Issues with self-esteem and bullying are associated with both depression and anxiety. In addition, depression was found to be associated with dating violence, obesity, issues with gender identity, sleeping difficulties, and lack of exercise and physical activity. An additional factor associated with anxiety was issues with self-assurance and feeling confident. There's a lot of critical data just there.
Number 2, 3 aspects of self-image issues are of considerable concern: body image, self-esteem, and feeling competent or self-assured.
Number 3, in terms of social issues and relationships, bullying is of moderate concern, but peer pressure is of considerable concern.
Number 4, more than half of the respondents, 58.3%, said that services provided were not adequate to meet the needs of the middle school girls.
And finally, number 5, we asked questions about the impact of COVID-19. Half of the respondents felt that COVID-19 pandemic and the resulting alterations in academic conditions will create problems for girls with respect to their academic issues. This includes a lack of confidence in their educational abilities.
The report further grouped the communities into 3 categories based on per capita income: less than $50,000, between $50,000 and $70,000, and more than $70,000. Less than $50,000, we had a 37.5% response rate. Between $50,000 and $70,000, we had a 31.3% response rate. And more than $70,000, we had a 31.3% response rate. The report found that there were more problems perceived in communities with lower per capita income. Specifically, there were more problems with sexual abuse, lack of exercise and physical activity, bullying, issues with self-esteem, issues with gender identity, anxiety, and depression. So to conclude, we want to briefly discuss next steps. The next steps include community outreach, community education, convening of girls-serving organizations, convening of school personnel, and the creation of an advisory council which would include experts, professionals, and girls. We thank you so much for your time, and we look forward to your questions.